By understanding your body and watching what you put in it, managing your symptoms of Crohn's disease can be simple and allow for a full and rewarding life.
In this video, we will define Crohn's disease, give some signs and symptoms, discuss treatments, explain how dietary fiber relates to Crohn's, and give evidence for our findings.
Crohn's disease is an inflammatory bowel disease characterized by inflammation of the digestive or gastrointestinal tract. Crohn's can affect any part of the GI tract from the mouth to the rectum, but is more commonly found at the end of the small intestine, the ileum, where it joins the beginning of the large intestine. The symptoms associated with this disease are diarrhea, fever, blood and stool, inflammation, weight loss, and food intolerances.
Crohn's disease is a serious disease with no cure. However, there are still treatments provided to lessen the severity. Treatments typically consist of drug therapy or surgery. There are a variety of drugs that can be used to treat Crohn's disease. A few of these drugs are corticosteroids, anti-inflammatory agents, immunosuppressive agents, and antibiotics. TNF inhibitors neutralize tumor necrosis factors, an immune system protein. Examples of these drugs are listed. Use of these drugs in both adults and children with moderate to severe Crohn's disease resulted in reduced signs and symptoms of the disease. In more serious cases, doctors turn to surgery. The surgery can consist of a portion of the digestive tract being removed. The downside of surgery is that it is not a permanent fix.
As for occurrences and at-risk population, Crohn's disease can develop in any age. However, it typically affects people 30 years of age and younger. Crohn's is more common in people who have a family history of the disease. Living in urban or industrialized areas can also play a role in developing Crohn's, as well as having an Eastern European and white descent. Smoking is a huge risk factor that can increase the severity of Crohn's disease. Our patients consist of adults with Crohn's disease with intervention of a high-fiber diet in comparison to normal fiber diets. Our hypothesized outcomes are to decrease GI symptoms and the risk of developing Crohn's disease.
The evidence that we accumulated for Crohn's disease coincided to our hypothesis. The interventions that we found in various studies were semi-vegetarian diets, high-fiber diets, and low-refined carbohydrate diets. The outcomes in each of the studies reviewed were increased remission rates, improved GI function, lowering in risk of developing Crohn's disease, lowering of active symptoms, and lowered inflammatory markers. To conclude, most participants had a decrease in gastrointestinal symptoms associated with Crohn's disease, with high-fiber, low-refined carbohydrate, or semi-vegetarian diets.
No one told you life was gonna be this way. Your job's a joke, you broke, your love life's the old way.